Hi, I'm Dr. Terry Fossum. You may know me from my book, Small Animal Surgery, but today we're not talking about surgery. We're going to talk about something that I have been working on now for a number of years, and I am extremely excited to share this with you. And it's some research that we've been doing around indications for Nerium indicum, or what you may know as Nerium oleander. So let's get started. Nerium oleander, Nerium indicum, is a plant that has been used for millennia for its medicinal purposes. Oleander is a cardiac glycoside. The one that we learned about in veterinary school was digoxin. Oleander is less well known, but they're both cardiac glycosides. They are not the same though. One quick example of the difference is that oleander actually crosses the blood-brain barrier, and digoxin does not. So cardiac glycosides, but different. Over the millennia, oleander has been used for cardiac issues, pulmonary, liver, and circulatory issues. Today, we're going to focus on some really interesting indications that we have uncovered. But first, I want to just mention that not all oleander is the same. So there are different colors of oleander, and if you live in an area like where I live, you see this plant everywhere. And so you're well familiar that it can be white, it can be red, it can be pink, but it is the same plant. It may vary in the concentration of the active, but that also varies depending on the time of year that we harvest. So this is a plant that likes dry, hot conditions, and that's when it grows the best. Now, what it is not is the plant that you see here. This is yellow oleander, and it has been in the news recently because it was being added to some dietary supplements, and that it could be lethal when that happens. You can tell by just looking at the plant that it is a different plant. So it is yellow oleander, but it is not the same plant as Nerium oleander. So that's important to know because we have done a lot of work on toxicity of oleander, and it's just not nearly as toxic as people would think. But yellow oleander, again, different plant, different product. So what we have determined after many years of research that yes, while oleander can be toxic, if you take a stick or you take the leaves and you chew them, it could be lethal. But when you dose it at very low concentrations, like microgram concentrations, so that we get nanogram levels in the blood, what we have found is that we see no toxicity at all, but it does have some really interesting clinical uses. One we're going to talk about today is it is an anti-itch product. So we'll talk more about that in a minute. It also has antiviral properties, and much of this is working through the same or similar mechanisms in that it strongly boosts the innate immune system. So we'll talk about its antiviral properties briefly. And then lastly, I won't spend much time on this, but there are some really interesting indications for cancer. The reason that we think it might be important for cancer is that there was a paper that came out a couple years ago now that looked at senolytics. And what they determined was that oleander was the most potent senolytic that they could identify. Now, what's a senolytic? Well, cells are not meant to divide forever. They're meant to divide, a certain amount of times, and then they get old and they start making mistakes. And so those cells are supposed to, as we all know, go down programmed cell death. But there are certain population of those cells that say, not today. I'm not going to die today. Instead, what I'm going to do is I'm just going to quit dividing, and I'm going to sit here and secrete some really inflammatory substances. And a lot of people now believe that that inflammatory milieu that sits around these senescent cells is what causes us to age. It's what's responsible for diseases, chronic diseases of aging. If we could kill those senescent cells, we might not age as quickly. But as importantly, we believe, and there's increasing evidence in the literature now, that those senescent cells that aren't being killed by the chemotherapeutics that we're giving may actually survive the chemotherapeutic. And then when we stop, they reanimate and they become metastases. So if we could add oleander to standard of care, we think that we might actually reduce or even eliminate the metastases that we see. So osteosarcoma, great cancer for us to study, osteosarcoma in dogs. Okay, so that's cancer. Again, not going to talk a lot about that today, but I think it's really exciting. This paper came out in 2023, and it compared a botanical extract. So we can take the oleander, we can extract the plant, and end up with, and we can do that with various different ways. You can use, subcritical CO2, supercritical CO2, a combination of that. You can use ethanol, methanol, solvent extraction. So there are multiple ways for us to extract. And for some species, we don't even extract. We actually use the biomass. But what this paper showed is that we have really interesting effects on the innate immune system in that we really give it a boost. So that was our first inkling of how we were really working through the immune system. And when I started looking at that data, I thought, oh my gosh, this looks like an anti-itch product. It really looks like oclocidinib, except that it's not immunosuppressive. It's actually boosting the immune system. So wouldn't that be awesome if we could stop the itching, improve skin health, and not immunosuppress these dogs in the process? Because frankly, we're all worried about skin infections in these animals, about whether it could allow cancers that are present to grow more easily or even induce new cancers. I mean, we just don't know. It's a risk. So wouldn't it be nice if we could have inexpensive but effective anti-itch product that did not suppress the immune system? So let's talk a little bit about atopic dermatitis. So we know that we have to treat this disease in a multimodal fashion. A single specific treatment rarely is the answer for any dog. So one of the things that we want to do is we want to repair the skin barrier. These animals tend to itch and scratch and bite, and their epidermal barrier is impaired. Um, and that causes them to lose water in their skin, and then they get that dry, scaly skin that we've all seen in these animals that are moderately to severely affected. So repairing the skin barrier is important. We know that we have to control inflammation and stop the itching. So for some, it may be that the first thing that we do is we check to see if these animals are having adequate flea control in their home, and if that might be part of the cause, because that's something we can treat separately. We do know that, atopic dogs are prone to recurrent skin infections, and that's a real problem. So we may need to put these dogs on an antimicrobial intermittently to treat this disease. Certainly, we can alter the immune response. We do allergen specific immunotherapy. disease modifying in order to make these animals less prone to react to environmental allergens. But it's a lengthy, difficult, and somewhat expensive process, and not one that every owner is interested in doing. And then, of course, we can have our owners avoid allergens if they can figure out what food is causing it. If it's a food allergen, that would certainly help. But again, this can be tough to figure out which allergens are really the issue. So let's talk about altering the immune response because that is how oleander works for this disease. So our current treatment categories are that we can try topical therapies that will remove allergen from the skin surface itself. Some of these products are actually designed to restore moisture to the skin. Some of them will treat ancillary conditions like yeast infections or secondary bacterial infections. And they are shampoos, sprays, and even medicated wipes out there. I know you've all used these. Some of the products contain antihistamines and corticosteroids to reduce inflammation. Not something we want these dogs on, at least steroids long term. And antihistamines, frankly, in my experience, don't work all that well. But you may have different experience. Allergen specific immunotherapy, I mentioned earlier, trying to find the specific allergen and then hyposensitize these animals to it. Again, the owners have to give a subcutaneous injection or give up the product under the allergen under the tongue daily. And it's not cheap, and some owners just don't want to do it. Oral medications are really, I think, the answer for atopic dermatitis in dogs. And certainly, again, we talked about corticosteroids and the fact that they help. I mean, they certainly will decrease the urge for these dogs to itch, but we know that there are long-term issues regarding the use of corticosteroids. So, not a first choice for anybody, I'm sure. Cyclosporine, immunosuppressant drug used because it's an immunosuppressant, is used by some people. It's probably the most expensive method that we have, but people do report some successes. Oclacitinib is the market leader for this Apoquel by Zoetis, and we'll talk more about that here in a minute. Antihistamines, again, may prevent the itchiness, but it doesn't work in all dogs. Essential fatty acids can help, and I certainly put my own my personal dogs all get essential fatty acids in their diet daily to help with skin issues. And then lastly on this list, I have Alleviate, and that is our new product that we are developing. And then lastly, the other category would be injectable medications, and Cytopoint would be the market leader there. It's a monoclonal antibody against IL-31, which is the itch cytokine, but it is an injection, lasts 4 to 8 weeks, depending on the dog, it varies. And but it's a subcutaneous injection. Can work for some dogs. The issue with it, when I talk to veterinary dermatologists, is that while it stops the itching, it doesn't reduce the inflammation, and inflammation is an important part of this disease. So what's out there right now? Everybody probably in this call is familiar with Apoquel. Again, Zoetis's oclacitinib chewable tablet's been on the market for over a decade. Effective, but not in all dogs. I think their initial study was maybe 56% around there. Effective. I think that has improved over time, but it's definitely not effective for all dogs, and it's expensive, which owners are often looking for a different solution. The next one I have here is Cytopoint, the injection that we just talked about. And then lastly, Elanco just came out with Zenrelia recently, which is a new, another anti-itch product. But it too is immunosuppressive. And so these are oclacitinib and Zenrelia are JAK inhibitors. And this, I think, was very interesting in that this came out with Zenrelia and it said, based on results of the vaccine response study, dogs receiving Zenrelia are at risk of fatal vaccine-induced disease from modified live virus vaccines, and they may have an inadequate immune response to any vaccine. Discontinue Zenrelia for at least 28 days to 3 months prior to vaccination, and withhold Zenrelia for at least 28 days after vaccination. What's that telling you? This drug is highly immunosuppressive. Honestly, not something I want my own dog on. But when you're desperate, you're looking for anything that will help. This is a paper that came out on oclacitinib 10 years later. And this came out was submitted in December of 2022, came out in February of 2023. And they just looked at the studies and case reports that have been published over the last 10 years and reported a review. And what they determined is, yes, it is highly immunosuppressive. They do not recommend using it in dogs less than 12 months of age. Don't use in dogs that have cancer, untreated parasitic or fungal disease, or that have autoimmune diseases. Don't use in dogs with serious infections. Don't use in dogs that are breeding pregnant or lactating. So a lot of do not use because of how highly immunosuppressive these various JAK inhibitors can be. So we started. We were really interested in looking at could this, be a substitute in some dogs, because we knew we could develop this product significantly cheaper than many of these other products. Particularly if we didn't make claims and we didn't go down the FDA route, but we just made it a wellness product with no claims. So we were very interested in exploring the toxicity of Oleander in dogs when given orally, because that information just didn't really exist in the literature. So we published this paper in JAVMA in March of 2024. And the purpose of the study was to determine the dose of oleander extract and the isolate oleandrin that we could administer safely orally to dogs. In this study, we took 42 purebred beagle dogs, and we used one of our supercritical extracts. And we performed 3 separate studies. The first study that we did was really a dose ranging study, and we only used 2 dogs, a female and a male. And we increased the dose substantially. So at the end, these dogs were getting 460 micrograms per kilogram. The male dog had no issues at that dose. The female dog developed a fatal arrhythmia, and we did lose her. Now, that was again 460 micrograms per kilogram. So, a very high dose. We did another study where we looked at um, a repeat dosing for 7 days. And we did that in 4 dogs. And again, we saw no toxicity at lower clinically applicable doses, but at doses, when you get high, what you will see, no surprise, because these are cardiac glycosides, is that you will see a prolongation of atrioventricular conduction, i.e., a prolonged PR interval and second degree AV block. Now, we didn't see that again until we got to relatively high doses, and doses even at like 23 micrograms per kilogram, where we started to see some prolongation of the PR interval. They were short lived abnormalities and totally reversible, and we saw no long term effects from that. Then we also did a 28-day study because we wanted to just make sure that, as if this was accumulating, that wouldn't result in toxicity. And again, anything less than about 23 micrograms per kilogram, we saw no abnormalities at all. But above that, you may see prolongation of PR interval and second degree AV block. So our assessment was that anything less than about 10 micrograms per kilogram, you should expect to see nothing. If you go above 23 micrograms per kilogram, it's worth monitoring these dogs. Quite honestly, below 15 or 10 or maybe in the whole 23, we don't even think monitoring is necessary because you're not going to see anything from a cardiac standpoint. About that, though, I would monitor these guys, but you have to go really high to get a fatal dose. So that was a exciting finding for us because we knew from some initial studies that in most species, an effective dose is pretty low. It's around between 2 and 5 micrograms per kilogram. So those doses, you're not going to see an adverse event. Now, if people went wild and they gave 5 times the amount that we're recommending, you could see a prolongation uh, of the PR interval. But until then, you're probably not going to see anything. So the next thing we did was an in-cell study with a head-to-head comparison of an oleander extract. Oleander is an isolate, so purified down to where we just had oleandrin, and then we compared that to oclocidinib in cells, and we looked at the allergic reactions in these cells. Well, what we found is that we saw a very distinct difference in the cytokine expression between oleander, whether it was the extract or the isolate, compared to oclocidinib. So here's some of the cytokines that we looked at. TNF alpha, we downregulate that more than oclocidinib did. Uh, Interferon gamma, interestingly enough, oclocidinib actually increased the expression of. We decreased. IL 12, 23, we both decreased, but we did it to a greater extent. IL 6 was actually slightly increased with oclocidinib, as was nerve growth factor beta. We decreased both of those. So you can really see across the board, we decrease these inflammatory cytokines. Oclocidinib does some of them and doesn't do others. So we thought that was really interesting. Now, unfortunately, what we could not test for because it wasn't commercially available was IL-31, which is the itch cytokine, and the human IL-31 did not cross-react enough to test it. So, how does Oleander work? Let's take a look at a video. Skin cells, as well as immune cells, produce substances that are known as cytokines. One of those cytokines is IL-31. When IL-31 is released from these cells and binds to its receptor, known as IL-31 receptor A, it activates the STAT3 mechanism, which then causes itching. Oleander is a beautiful ornamental plant, and when the components are extracted and given at a very low non-toxic dose, the active component oleandrin inhibits IL-31. Thus, the STAT3 mechanism is not activated, leading to non-scratching and happy dog. So we have developed a number of products now with a safe amount of oleander in them. We started off with a topical spray, and we did that because from a regulatory standpoint, it's considered to be a device, and devices are not regulated in veterinary medicine. So this was really a pretty low bar for us to enter the market. Just spray it directly if they have a flare or they're licking their feet only. You can just try spraying this. It's worked well in my dogs, and we are selling quite a bit of it internationally as well as in the US. So, a product you might want to look at. A product that we are currently developing, which I'm really excited about, is a leave-in conditioner or rinse because we really need to address that itching, and we believe that something that repairs the skin barrier and allows oleander to really sit on the skin surface is going to do that. So keep an eye out because that leave-in conditioner, I think, is really going to be the ticket for adding to our oral product and really getting these dogs to stop itching and improving their skin barrier, and doing so in a manner that's not going to break the bank or going to immunosuppress these patients. This is just a user that sent us these pictures of their dog because they've been trying to heal this lesion for about a year and a half. And every time they start to get it healed, the dog will start licking and chewing it again. And so they used our product after 14 days. You can see it's starting to look like it's healing. After 30 days, it looked nearly healed. And after 90 days, the hair had regrown. The owners were thrilled because nothing else that they had done had afforded them this kind of benefit. So we do have an oral. It's a product that we have just recently come out with and been testing. And we're really excited to introduce that to the market. We started off with a chew, and because we thought that would be a very reasonable way to provide this product. And what we found is that first, a couple of things are a little surprising. So we did a 30-day randomized, blinded, placebo-controlled study at a couple of veterinary clinics, one in California and one in Texas. And one of the things that surprised me the most was that we had a fair number of owners who we wanted these dogs off any anti-itch medication for a week and before they started our product. I thought a week was reasonable. We had a ton of owners drop out after 3 or 4 days. They said they just could not tolerate having their dog off an anti-itch product for an entire week. It was just making them crazy. And we've all sat there by a dog that's itching uncontrollably. I get it, but I was really surprised. So we didn't get a ton of dogs in the study. Um, But what we did show is that almost across the board, we were able to improve their cadesi scores with this oral product. Again, what we found too, though, in this study is that even the dogs that were on placebo didn't always take the chew. So we decided that there might be a better way for us to administer this product. And so what we have gone to is an oral pump solution. Part of the issue with the chew that we thought was happening is that the material in the chew was actually binding the oleander, and so it wasn't getting absorbed in the amounts that we had hoped that was being absorbed. So this pump, we like oleander to be given not with food because again it may bind and not get absorbed. So the pump you can just put on a small little piece of cracker, pork rind, whatever your dog will eat. Uh, it's a pump, and depending on their size, and you get about 0.22 mLs per pump, and we've got instructions depending on the dog's weight how many pumps. We really think this will be a more effective solution and relatively inexpensive. Again, the topical we think should be used when there is, say, a focal area that the dog is bothering or an acute exacerbation of their itching and they get a hot spot. That's what I would use the spray for. And then if we can get the owners to use a leave-in conditioner once a week, I think we have this problem licked. Or at least it's pretty exciting. So let's take a look at the competitive landscape. Oclacitinib is about 89 bucks a month. It is in pill or chew form. It can be taken with food, with or without food, so that's nice. I do think it is effective in many dogs. Side effects, we've gone through those, and I think they're really important. And the most important being that it is immunosuppressive. Cyclosporine is going to cost you a bit more, 120 bucks a month. You have to give it orally 1 to 2 hours before meals. You don't want to give it with food, so not different than our product. Again, can be effective, but it is highly immunosuppressive. Cytopoint, a bit cheaper, but for the product, but you're going to pay for a vet visit. It's an injection that's given by a veterinarian every 4 to 8 weeks. Again, can be effective, but again, does have side effects. And this I don't think is immunosuppressive because it strictly targets IL-31. But again, it also does not do anything for the inflammation that is present. And then lastly, we are targeting less than $45 for a month's supply of Alleviate. It is an oral ingestible pumped onto a small amount of food, but not into their regular mealtime food. It appears to be highly effective. We have seen no side effects to date. It supports a healthy immune system instead of suppressing it. Okay, so that's our anti-itch. I'm pretty excited. Again, we're not planning on going down the FDA pathway because if we did, we'd have to sell it for the same amount as Apoquel is being sold. And we really are looking for a product that people can afford that maybe don't always have a big checkbook. There are a lot of dogs out there suffering, and we really wanted a cost-effective product. And so we're even working on trying to get the price down even more. I'm pretty excited. I do want to mention some of these other indications because I think they may come around to affect small animals, companion animals as well. So one of the things we are working on in production animals is the antiviral indications for this product. And a number of years ago, a couple years ago, we did some in-cell work looking at oleandrin. PBI 05204 is a supercritical extract of oleander. And we looked at bovine viruses of importance, and we found that for a number of different viruses, bovine viral diarrhea, bovine respiratory syncytial virus, and bovine coronavirus, we significantly eradicated those viruses in cell treatments. We also looked at pigs, and we did the same thing. We got any enveloped RNA virus, significantly reduced them. Let's take a peek at the video and how Oleander works against envelope viruses. Envelope viruses invade our cells and rapidly produce large amounts of their own proteins. This overloads the cell's normal system for folding proteins, thereby causing stress by throwing the calcium levels out of balance. In response, the cell activates what's called the unfolded protein response. A key part of this response is a helper protein called GRP78, which can protect the cell. But if GRP78 shows up on the cell surface, it can also help more viruses attach. So even though some GRP78 is required, too much GRP78 is not good for the cell. Oleandrin comes to the rescue by keeping the cell's calcium balance in check, which is crucial for proper protein folding. It lowers GRP78 levels and prevents the protein from moving to the cell surface. As a result, the virus has trouble creating fully functional particles, making them far less infectious, up to 10,000 times less. Even at very low doses, oleandrin effectively helps the cell fight off infection without causing toxic effects, giving our natural defenses a strong boost. Okay, so canine cancer, I mentioned earlier because of the senolytic effects. But interestingly enough, oleandrin also sensitizes human osteosarcoma cells to the platinum-based chemotherapeutics. And it will also reverse resistance to those drugs. So that's pretty exciting, and it's just another reason we really need to look at the cancer effects of oleandrin and whether we can prevent these metastases that end up killing all the dogs with osteosarcoma that we treat. One of the diseases, viral diseases that we've done most of our work in to date has been a disease. If you have done any large animal, you'll recognize this disease. Porcine respiratory and reproductive syncytial virus. It accounts for about 1.2 billion in losses annually to porcine commercial producers, and that is despite a vaccine. There's a number of vaccines out there, but this is one of those viruses that mutates readily and often, and therefore the vaccine is poorly effective. Interestingly, avian influenza is also a enveloped RNA virus, H5N1, and we have done in-cell studies on H1N1, and we know that we get that virus, so we have good reason to believe that we would get H5N1 as well. And so we are currently looking at what studies you might be able to do to see if we can stop what many people believe is going to become a pandemic. Once we get mammal to mammal transmission of highly pathogenic avian influenza. But for PRRS, we've done a number of studies now, and what we found is that because we're not virus specific or even viral strain specific, what we're doing in these studies that we've looked at is we're really reducing the viremia um, in the entire barn, not just in the animals that we treat. So we're pretty excited about the potential uses to reduce some of these really devastating viral diseases. Production animals, one of the viruses that we get very readily is coronavirus. So we definitely need to look at this for feline infectious peritonitis as well. PERS 1.2 billion in losses. We grow oleander in South Texas. This is a picture of our farm. And, everybody worries about the toxicity of oleander. When we harvest, people are not wearing, uh, personal protective equipment or PPE. They're not wearing masks. They touch this plant. Oleander is not absorbed topically and it's not toxic when it's inhaled. This little guy, this little fawn, was born in our oleander fields. We have done a number of studies now looking at toxicity in various species. And what we found is that mice and poultry appear to be totally resistant to oleander. We have not found a dose that will kill either mice or chickens, or turkeys for that matter. I think millennia walking through oleander fields has probably made them immune to its effects. Rats require a really high dose. Human and dogs are significantly less. But again, we didn't really see anything until we got over 10 in our studies. So we're pretty comfortable with dosing this in multiple species. We have not found the lethal dose in pigs yet, but we're sure that's just a matter of dosing and time. So I mentioned bird flu. We're pretty excited that we might be the answer to stopping this pandemic, and are currently in discussions with the USDA. But as I said, chickens are totally resistant. Um, but as you all know, it's test and slaughter and wipe out the entire barn right now. We'd love to get permission to test. We have a BSL 3-4 facility that we can do challenge studies in. So we're pretty excited that we might be the answer to stopping this outbreak and reducing or eliminating the threat of mammal to mammal transmission, which will not be good for humans. And again, I'd really like to look at it for cats that are dying from bird flu. We have dosed some cats. We don't have a lot of toxicity information in cats, but the 4 to 5 micrograms per kilogram we've not seen any adverse side effects with that. So I mentioned on the next horizon, we're looking at cancer. What we know that we do is we reduce GRP78, which is induced when cells are stressed by both cancer and COVID. This particular publication came out of USC last year, and they really are the ones that really nailed down the mechanism of action of oleander. And that same mechanism of action, reducing the expression of GRP78, is likely the mechanism by where oleander benefits us both for cancer and for viral diseases like COVID-19, another coronavirus, as we all know. The other mechanism of action of cardiac glycosides is that most cells on their sodium potassium ATPase pump, they express the alpha 1 isomer. So that's the typical expression. Some cancer cells and some virally infected cells upregulate or express a different isomer called the alpha 3 isomer. And the alpha 3 isomer is actually where oleander binds. So it should not affect normal cells. It should affect these cells that have upregulated the alpha 3 isomer. And we can actually assay for that. So we have a biomarker that we can say this drug, the oleander, this ingredient, this product, should help with this cancer because the alpha 3 isomer is upregulated over the alpha 1. Or we can say the opposite. It's not upregulated. Alpha 3 is not upregulated. It shouldn't work. We don't have that ability to test many chemotherapeutics before we actually give them. So I thought that was kind of an exciting idea. Hopefully we will be able to look at this in cancer. This just showing we initially did some initial studies just looking at which cancers express the alpha 3 isomer. This is pancreatic cancer in humans, and you can see it's a strong upregulator of alpha 3. I would love to see oleander used in addition to standard of care in pancreatic patients because we don't have really anything good to offer them. Human osteosarcoma strongly upregulates alpha 3. You can see mice do not. That's probably why they are resistant or tolerant to oleander. Canine osteosarcoma highly upregulates alpha 3, should be very responsive to oleander. And this is just a different human osteosarcoma cell line. Again, highly upregulates alpha 3. So pretty exciting potential there. Oleander, just to summarize, appears to reverse resistance to some chemotherapeutics. The ones that are mentioned in the literature are doxorubicin and the platinum-based drugs. It kills senescent tumor cells, so it may prevent the metastases that we see. And it specifically kills tumors that have upregulated the alpha 3 isomer. Just another paper talking about cellular senescence, aging, cancer, and injury. I've already told you the theory behind why senolytics will benefit us for aging as well as for cancer. So I won't do that again, but it's pretty exciting. And this is a publication where they used AI to look for senolytics. And then once they had identified their top 3 senolytics, they then tested them in cells. And this is a publication out of the University of Edinburgh that said that the most potent senolytic they could identify was oleander. You know, keep up with what we're doing in this area. We're pretty excited. We do think that there is a potential for some really major breakthroughs. We're excited to crack this idea that people have to spend $100 a month to keep their dogs comfortable from itching. Again, we're very hopeful that the combination of the oral and the leave-in rinse with occasional use of the spray will do the trick. And if it does, it will be significantly less expensive and it will not immunosuppress these patients, which I think is really important. Thank you so much for your time today. And my email is Terry, Terry, at drfossums with an s.com. If you have questions, feel free to email me. I'd love to hear from you. Thank you and take care.
So we know that watching a single webinar isn't really enough information for you to start referring customers to us. We're sure that you have more questions, and there will be a link that you can click on to book a session with Dr. Terry Fossum so she can answer any additional questions that you have. We want you to be comfortable in potentially recommending our products to your customers and feel confident in being able to answer any questions. We also have a phone number that's all over our website. It's 413-367-7867. Again, 413-367-7867. If you have any questions, please feel free to give us a call. We will do everything that we can to answer your questions as well as your customers' questions. We really make an effort to take the burden off of the veterinarian. So if you're looking to be an advocate or an ambassador for Dr. Fossum's Pet Care, first of all, we would really appreciate it. And second of all, we'd be happy to, give you some rewards for your efforts.